Inspiration is just a story away.
Welcome to Inspiring Lives with Dr. Shellie. I'm your host, Dr. Shellie Hipsky. All of our guests have conquered obstacles, risen above adversity, and have gone on to help others. Today's show is about dealing with health-related issues. Our first guest lives with celiac disease and arthritis, and if that wasn't enough, she's been through brain surgery as well. These days, she's a health advocate, author, and social media guru. Please welcome Ashley Boynes-Shuck. Thank you so much for being here.
Thanks for having me.
Absolutely. I'd like for you to first describe your personal journey with these illnesses.
Around the age of 10, I started having aches and pains that would happen after softball games and just continue to get worse and worse. And at first we thought it was just from playing sports, but when my injuries wouldn't heal, it became a red flag, and I finally saw a rheumatologist and was diagnosed with juvenile rheumatoid arthritis, which is the autoimmune form of arthritis. And through the years, I kind of struggled with that and have kind of picked up a couple other ailments along the way, you know, including celiac disease and the Chiari malformation.
Wow. Oh my gosh. So I'm looking at you, and for me, I don't see like someone that has arthritis. Yeah. Like I picture arthritis, you know, a little lady bent over with glasses or something, not a beautiful young lady like yourself. So how do people react when you say, I have arthritis?
I mean, it's actually pretty absurd, the reactions that I've gotten.
I'm sure.
Even in high school, I had teachers that were suspicious that I was kind of faking it or didn't really have it or just wanted attention. I got bullied by some of my peers who would make fun of me for walking with a limp and kind of think I was lying because it is an old lady's disease, or so that's the, you know, common misconception.
Absolutely. Statistics from the Arthritis Foundation said 300,000 children have this?
Yes, it's actually one of the most common childhood diseases, but it's vastly underdiagnosed or misdiagnosed. And part of that is because of the stigma that it's an old person's disease. But you know, there's toddlers that get arthritis, there's someone like myself who has it, and, you know, yes, elderly folks can get it, but they're not the only part of the population that can be affected.
Absolutely. So, brain surgery, can you talk to me about that? How did that affect you?
It affected me on a lot of levels, obviously physically, but also emotionally, because that was something difficult to have to go through. It was also a relief, though, because I went a very long time having certain neurological symptoms that my doctors really couldn't figure out what the cause was. And finally, a neuro-ophthalmologist was the one to make the diagnosis, met with a neurosurgeon, and had the surgery in February of 2011. It did help a lot of my symptoms, but it was a little bit scary to go through.
Oh, I'm sure. Absolutely. So you described some neurological symptoms. Can you describe that?
Yeah, I actually would wake up almost every morning with nausea. And so initially I thought it was a gastrointestinal problem, but the more specialists that I saw, they kind of thought maybe this is something neurological. And then I would get severe migraines every day, pain behind my eyes, tingling and numbness in my hands and feet, pressure in my head, constant ringing in my ears. It was just a whole plethora of symptoms that would not go away with migraine medications or anything like that.
Absolutely. Can we take a peek at Brandon? Oh my goodness, look at that. What were you going through when you went through that?
This was pretty short after my surgery. The scar is about 6 inches or so. I still have it, of course. It doesn't look like that, thank goodness. This is as it was starting to heal. I was really self-conscious about the way I looked and still sometimes feel awkward, you know, wearing my hair in a ponytail, but I've actually ended up sort of embracing my scars because I don't look at them anymore as a flaw. I look at them as something that I had to go through, and I'm still here, I'm still standing, and I kind of look at them as a sign of strength.
Absolutely. So you're really a survivor, which is awesome. What has been the most difficult part of living with these health issues?
I think for me, being an overachiever and a go-getter and a very active person that has a lot of dreams, the hardest part for me has been not feeling normal and not feeling like it'll be as easy to reach my dreams as it might have been had I been healthy. So there's always that what if thing, you know, I feel like I'm doing a lot now, even living with health issues, but a part of me always wonders, you know, what more could I be achieving had I not, you know, been straddled with all these problems?
Yes.
But I just kind of take it all in stride, and even though I do have days where I get down about it all and I get frustrated, I think everybody, healthy or not, has those kind of days, and I just accept them and move on, and I try to turn my negative health situation into something positive.
Which is beautiful. So you're turning that struggle into a strength, and I
Yes.
love it. I love it so much. Ashley will be back a little later in the show, but when we return, we'll meet a physical therapist who's worked with professional athletes as well as many of us weekend warriors for more than 25 years. She's got some great ways for us all to stay healthy, especially if you're dealing with complications from a health issue. Stay with us.
Inspiration is just
The people that inspire me are the ones that see a need and they do whatever they can to try to fix and fill that need. So they think of others before they think about themselves, and to me that's so inspiring. And the other people that inspire me are the ones that are encountering severe challenges in their lives, but they keep a smile on their face and they do what they can to uplift you. So to me, those are the people that inspire me, the ones that think about others before themselves, and the ones who, despite significant challenges, they find a reason to be positive. And that to me is very inspiring.
Remember, we want to know what's inspiring you, so be sure to go to inspiringlivesinternational.com and tell us your story. We're talking about health-related issues today. Joining us now is a physical therapist who works with all types of clients, from professional athletes to those of us who get hurt just by looking at a sport. For more than 25 years, she's been helping to guide clients towards healthy movement. Please welcome Alice Beckett-Rumberger. I'm so excited to have you here, Alice.
I am so happy to be here. Thank you so much for having me.
You're welcome. Tell me what you do as a physical therapist.
Well, my job as a PT is physical medicine, physical rehabilitation. We take people who have been injured or have a disease process going on and make them healthy and strong through exercises and what we call in physical therapy land modalities, things like ultrasound and heat, and then get them functioning.
Excellent. I know that you like inspiring lives and working with PT, but I also know you outside of the studio and outside of the PT stuff as a mother of, get this, 7 children, okay? So how do you stay so fit and trim and healthy as a mother of 7 children?
Well, 7 is a big number, and it can be a juggle. And honestly, it's all about finding balance. It's finding balance and having a fulfilling career and being a mom and doing things that I like to do, and I like to change it up. There's so many different kinds of exercises out there. So one day I'm doing Zumba with one of my daughters, and one day I'm running the park with my husband, and other days there's no time, so I make a workout out of cleaning the bathroom.
Okay, so Ashley Boynes-Shuck is in the studio with us today, and she's not a client of yours, and we all know that, but can you tell us some of the ways that if Ashley walked in to, say, work with TheraFusion or to work with something else that you're doing with PT, what would you tell her? How would you guide her?
Well, Ashley is a fantastic person. It was so nice getting to meet her today, and first thing I would do is perform, like every physical therapist does, is a musculoskeletal evaluation. And with people that have arthritis, especially the unique combination of arthritis that she has, osteoarthritis with rheumatoid arthritis, mostly the joints are affected, but because arthritis is a connective tissue disease, that it can also affect the internal organs. So I ask my patients and my clients, what's the biggest limiting factor in your life? And then we work a treatment plan with those goals in mind. So because I've been a PT for 25 years, I have a big, what I call, toolbox of exercises that people can do. And recently I have training in yoga and Pilates, and I add that to their treatment plan.
Alice, Ashley, and I all believe in the health benefits of yoga. Let's take a peek at Alice as she leads a group through some yoga poses to help with their specific health issues.
Hey, welcome guys! We're going to do today some yoga, some simple poses or asanas for people that have arthritis. In the back we have Kelly, and she will be working with a chair as something that will help people if you can't move into these poses freely. You have a chair to help you. We also have some blocks. Ladies, feel free to use them if necessary. Let's get started. Let's get into strong mountain pose. Everybody move to the front of their mat. Arms at your side, feeling strong and ready to begin the day. And take a deep breath in and breathe out. For the next inhalation, we're going to inhale our arms to the sky. Taking a deep breath in and out. If you feel ready, you can take an inhalation in and do a gentle back bend back. Come to straight. And we're swan diving all the way down into forward fold. And forward fold, I'm going to have you put your hands right in front of your feet. If you need to bend your knees to get to this position, feel free to do so. If not, let's enjoy this forward fold position as we take an inhale in and exhale out. On the next inhalation, we're going to take our right leg and bring it back. So let's inhale in and move our right leg back into a low lunge, straightening out our head so it is in line with our spine. Taking a deep breath in, taking a deep breath out. We're going to take the next inhalation and bring our left leg back. So inhale, bring the left leg back, and we're in plank. If you need to, from plank, you can move down to your knees, or you can stay up in plank, making sure that your head is in line with your spine. On the next inhalation in, we're going to inhale and lower our bodies down to our sticky mats. And on the inhalation, you can either come up to cobra or to upward facing dog. Enjoying the nice back bend of the spine. Take a deep breath in, breathe out, breathe in. And the next exhalation, we're lowering our chest back to our sticky mats. Gonna curl your toes under. You can come straight up to plank, or you can feel free to come right to your knees. Either way, respecting your body and where you're at today. Making sure our head is in line with our spine. We're going to take an inhalation, and we're going to bring our left leg up to our hand in a low lunge. Breathing in and out, enjoying this stretch of our hips. And now we'll bring our left leg or our right leg up to our left leg on the next inhalation. Stay in forward fold for an inhalation. Exhalation. The next inhalation, rising all the way up, our arms to the ceiling. Inhaling, exhaling, inhaling, bringing our hands together, the center, and dropping down to heart center. Inhaling and exhaling.
Thank you for leading us through those yoga poses, and thank you so much for helping keep Inspiring Lives audience well. Thank you for coming.
Thank you for having me.
Absolutely. Next up, Jennifer Hain joins us with this week's Gratitude Giving segment. Then Ashley will return to tell us about some of her work with social media. Don't go away. Welcome to a fabulous edition of Gratitude Giving. It's near and dear to our own Jennifer Haynes' heart, and I'm going to sort of pass it over there while I eat a banana split.
Yes, thank you, Shellie. So I brought you a banana split today because banana splits kind of hold a certain meaning to me now. Ryan Superman Roberts is a 22-month-old boy who has touched the lives of so many. And Ryan was actually born with congenital heart defect as well as Down syndrome. And he, unfortunately, a little over a month ago, passed away 4 days shy of 22 months old. And he just has left quite a legacy.
He really has.
So you will see me today wearing My Heart Beats for a Child with CHD. And this was from a certain fundraiser that was done by Ryan's family to raise money to offset so many of the hospital costs that they've had to live with since Ryan's birth, unfortunately. But he was an amazing little boy. I had learned about Ryan going into the grocery store one day. There was somebody who was doing a fundraiser there selling candy. And sure enough, I was just going to buy some candy to support the cause. But then I saw this beautiful picture of Ryan and what the cause was for, and was instantly gravitated toward it. So I began helping with fundraisers for baby Ryan, and they call him Superman just because of how much a hero he's been to family and those who he's met. And sure enough, you know, as things went forward, he had undergone so many heart caths, valve procedures, and unfortunately they had realized, you know, a little over a month ago that there was not much else that they could do for Ryan. While his mother, Diane Roberts, has been so positive throughout this all and quite the inspiration to me. To make a long story short, on Facebook, I became friends with Diane and started following her posts, and she was posting things encouraging parents to cherish the time with their children.
Absolutely.
One of those times being having banana splits with their kids for dinner. So this post was made simply as just a gesture of something a parent could do with their kids, and it spread through Facebook. This movement of over 70,000 people joined this Facebook page to have a banana split for dinner.
Love it.
Yes, so it was incredible, and it also hit every state and every continent. People sending in pictures having banana splits with their kids for dinner.
That's awesome.
So that was so interesting. And the reason why I wanted to talk about Ryan's story today, not only to honor his life, but also to speak about an organization that has contributed so much to his family as well as the family of others. So here, why don't we go ahead and take a look at a couple of pictures that I have of Ryan, just so you can kind of see. This is him shortly before he gained his wings. He was in the hospital, the happiest child ever. I mean, there's him with the beads of courage. So that the strands of beads that you'll see are what the organization that we're talking about today does for children. Ryan, right before one of his surgical procedures, the doctors were awesome. They would all kind of gear up in Superman gear in honor of Ryan.
I love it.
Yes, and here you will see what's called a bead of courage. They designed a banana split one specifically for Ryan, just to give him strength and in honor of his banana split for dinner party.
I love it.
Yes, so they've done incredible things. Beads of Courage is why we're here today. And so why don't we go ahead and take a look at the video here. It's a brief clip to inform you a little bit about the company.
This is a bead of courage. Every time a child gets a medical treatment, they get a bead. This one's for a spinal injection, surgery, hair loss. This one's for entering intensive care, catheter insertion, blood transfusion, dialysis,
bone marrow transplant. All my trips to chemo. These are my beads of courage, and they help me take the next step.
Dr. Shellie Hipsky's latest book, Ordinary People, Extraordinary Planet, is inspiring lives around the world. Find your copy at major bookstores and on Amazon.com.
Today's all about health-related issues, and our guest is Ashley Boynes-Shuck. Now, Ashley made a conscious decision not to let her many health issues define who she is or what she's accomplishing in life. Welcome back, Ashley.
Glad to be here.
Thank you. You are an award-winning blogger, which in this day and age is pretty darn impressive. Your favorite quote is by Toni Morrison, and it's, "If there's a book that you really want to read, but it hasn't been written yet, then you must write it. And obviously you heard that call because you've recently co-authored a book?
I have. It's with a group of young professionals and people that are active in the community around Pittsburgh. It's called Empowered in Pittsburgh, and it's going to launch on August 26th. It's with Tom Baker of Get Involved Inc. and a few other people that are, you know, kind of movers and shakers in young Pittsburgh. So we each authored a chapter, and mine is sort of on not saying no. So if an opportunity arises, I feel that you should always just take advantage of it. So it kind of just discusses that concept and kind of getting involved in the community and giving back. And my whole perspective was focusing on what you get out of that, you know, and what I get out of giving back and what I get out of saying yes.
Awesome. Well, I'm glad you said yes to the show.
Me too.
I know that you're also doing some other things along that same line of empowering women and getting together, and you're the president of an organization called Femfessionals that just started up, correct?
Yes. Actually, Femfessionals is a national organization for women. It's their slogan is innovatively connecting ambitious women, and that's what it's all about.
Love it.
It's a social and professional networking group for women of all ages and backgrounds, and I've recently been named president of Fem City Pittsburgh. So we'll have monthly connection lunches and pink collar workshops and all kinds of things for women to be able to kind of just get together and have fun while also networking and learning at the same time. I'm really excited about it.
That's awesome. I'm such a believer in empowered women and women connecting and coming together. You're also the blogger for Glitzberg. I love that name, Glitzberg. It's cute. And the author of multiple fashion and health-related articles that are out there. What was your favorite celebrity moment, celebrity encounter?
Well, I've met and encountered a lot of celebrities that I was really excited about. Actually, I almost had a heart attack when Justin Timberlake said hello to me. But my favorite is actually when last October, Oprah Winfrey tweeted me. She personally reached out to me on Twitter to kind of thank me for helping people emerge from pain and to kind of, you know, say something about the work that I've been doing inspiring others. Awesome. It was such an exciting moment for me because she's always just been one of my idols, and it was just very cool. I think Oprah is, you know, you can't get much better than that, except Dr. Shellie.
Thank you. I'm honored and humbled. Obviously, you're very fit, you're very healthy now. We did the yoga segment. I saw that in person. Let's take a peek here at you being healthy. What are we doing here, obviously?
This was this summer at Hilton Head, riding bikes on the beach, which was a great experience.
Excellent. And then?
And this was also in Hilton Head, doing yoga on the beach. It was the first time I'd done beach yoga, and it was just so cool. It was so serene, and it was so neat to just look out over the ocean and kind of focus on gratitude and mindfulness. It was just really nice.
I love it. That's awesome. So, gratitude. You said to me one time that sometimes you feel gratitude for what you've been through. What were you referring to? Gratitude for all this pain, from brain surgery to arthritis?
Yeah, I know that seems very counterintuitive, and it took me a while to get to that place. I'm not saying I never have bad days where I get down, because I do, but I am very grateful for the fact that these illnesses have shaped me. They've helped me become a more understanding and compassionate person towards others. It's helped me become a stronger person, and honestly, doing the advocacy work, being Arthritis Ashley, and all the stuff with the Arthritis Foundation has really just afforded me opportunities to help and inspire people and do things that I might not have been doing otherwise. So I'm reaching a lot of dreams that I always thought I would, and it looks a little different because a lot of it is health focused, but I'm not ashamed of that. I'm very proud to be helping other people, and I don't know if I would be in that position without, you know, everything that I've gone through.
That's beautiful. And what is the National Arthritis Foundation?
The National Arthritis Foundation is kind of the leading nonprofit organization that's solely devoted to rheumatic diseases. There are 117 types of arthritis and related conditions, and they kind of raise money for research and patient advocacy, patient resources, and community education. And are always at the forefront of trying to find a cure for arthritis, but also to help people live better with arthritis.
What's that dream project in the back of your mind?
I think that my husband and my family and friends and anyone that knows me knows the answer to this one, and that is to publish a book. I have been involved in a couple of book projects where I'm a co-author or one of many people that's on the book, but I write fiction, and I would love to write a novel. I want to be like the next J.K. Rowling or Stephanie Meyer, you know.
Fantastic.
Best-selling novel turned into a movie wouldn't hurt. You know?
So we'll be looking for that then. Someday we'll be looking for Ashley Boynes-Shuck's fictional novel down the road. But until then, we will be looking for which book coming out soon?
Empowered in Pittsburgh.
Empowered in Pittsburgh. Thanks to all of our guests this week, to Ashley, who demonstrates that who we are is not defined by what we cannot do, rather by what we can achieve. And thank you also to Alice Beckett-Rumberger for showing us proven ways to help keep our body healthy. Everyone has strengths and limitations, but we must decide to soar with our strengths and give back to others. Until next time, I'm Dr. Shellie Hipsky, and remember, inspiration is just a story away.
You were healing was you.